Hello, my name is Sheila Lewis. I'm a cardiac patient of Dr. Baxter Montgomery. I had an abnormal EKG and that I had to have a cardiologist to sign off and give me clearance in order to be able to have the procedure done. So at that point, I started basically trying to look for a cardiologist, and one evening my husband and I were watching Channel 13 News, and we saw this young doctor on there. Once I started coming in to see Dr. Montgomery about my heart, we went through a series of tests, and I can't count the number of tests that I had to go through. But at the end, the result was that I had congestive heart failure.
So we had these findings, which many individuals would think is unusual for a female. However, I want to point out to our listeners that heart disease is the #1 killer of men and women. And in fact, more women die from heart disease and heart attack than men. Although she's young at the age of 46, we know that coronary artery disease can be found in individuals as young as 15 years old in autopsy studies. And some autopsy studies have shown that you can have a high prevalence of gross coronary artery disease in young men, average age of 22. So this finding should not be surprising when you really look at the science behind it. So with the agreement of the patient and her husband, they decided to take a less aggressive approach up front, and they decided to proceed with a nutritional, whole food, plant-based diet. We also added medications to the regimen. We also treated her with a non-invasive revascularization technique, or a non-invasive way of helping the heart improve its function, called ECP therapy.
You know, he went through some of the things that I needed to do, some of the procedures that would be available to me, and of course, you know, there was the bypass, the implants, the defibrillator, and the pacemaker, the stent, and all of that. But the very last thing that he told me was that he could help me by simply working with me with changing what I eat, what I put into my body, and then a series of meds, you know, to work with the high blood pressure and the cholesterol, that I will be able to reverse my condition. And he's seen it done. I could reverse my condition without having the surgeries, and that really appealed to me. And so, of course, me and my family said, let's do it. Now, we have been praying that, you know, that will be a way out, that I wouldn't have to have the surgery. Okay, so I would say maybe the next 5 or 6 months, Dr. Montgomery put me on a very strict vegetarian diet, and boy, I tell you, it was probably one of the hardest things I've ever done, because I'm such a huge carnivore. I love meat. I love to eat. My husband is an excellent cook, so that was very hard for me. And we actually started the diet in the month of December, which was the holiday month. All the holiday parties, the banquets and dinners, everyone was eating buffet, banquet style, and I was sitting there with my salad. And so it was it was something that I really had to make a big adjustment in my life. But I did it because the options that were placed before me and the condition of my heart was so serious, is that it was a situation of life and death. Either make a change and live, or continue the way I was going and die. And I have children, grandchildren, and I want to be here for them. So I made the sacrifice, and stuck to the diet as much as I possibly could. And so over the next 5 months, I had to go through 35 sessions of ECP therapy. I took medication for my blood pressure. I think I had 2 prescriptions for blood pressure, and 1 for cholesterol, and of course I had the heart medicine for angina, which helped to alleviate some of the chest pain that I was having. I did that up until May of this year. Actually, on May 19th, I had to go back in for a 4-hour MRI. Dr. Montgomery got the results, and I called in, and he told me that he was scratching his head, and some of the doctors at Hermann Memorial was scratching their heads, because the MRI showed that there was no blockage in my artery, which in December it showed 85% blockage. It also showed that my heart was beating normal. It was pumping normal, and it's just amazing the results.
Just to show you the still image of the before image, you can see here with the catheter on the before image, you have critical narrowing at an area that was right about here. And so in the 5.5 months after the plant-based nutrition, we brought it back to the cath lab. We retook this picture, and you can see right here that narrowing that was tightly pinched in is now wide open. That's an amazing result.
I just have to say this, is that it works. God designed our bodies to heal itself. And if we give it what it needs, if we put the right stuff in it, we will give our bodies the tools it needs to heal itself. And it's just amazing. And I can remember laying on my sofa just crying after I got all this good news. And I was like, okay, God, because I know I prayed and I prayed back in December to ask God to heal me. And He did. And, excuse me. He had done it for my pastor. My pastor had 85% blockage a couple years ago. And instantaneously we prayed and God removed that blockage without any type of procedure. And I prayed and I said, God, I say, you did it for him. Can you do it for me? I don't want to have any of these procedures. And so as I laid on that sofa crying and thanking God for what He had done for me, I said, well, God, what is my testimony? What actually happened? And I just heard in my spirit, He said, you were your own miracle. He allowed me, and by that, what He meant was that He allowed me to participate in my own healing. He allowed me to be the miracle that I needed by, He was there all along, but He just showed me is that He designed these bodies to heal itself. And if we give it the right stuff, the right tools, it will heal itself. And so that's just my testimony, is that God led me to a good doctor, and I followed his instructions and did what he told me to do. And right now, my heart is good. My heart is strong. I've been jogging. I've been exercising. And so now I'm actually getting prepared to go through some training so I can be a more dedicated health minister for my family, for myself, and for those that, I meet in my life, so I can share the good news with them in an effective way. And so that's basically my testimony.